Thank you so much for being with us. If you can please introduce yourself and let us know which organization you are representing.
Thank you very much. My name is Kwamboka and I am a director at African Renaissance. African Renaissance is a charitable trust that has been established to combat or to fight inequality, inequity, and injustice. We work across Africa and we collaborate with different partners to advance policies and financing that can advance gender equality, health equity, and socioeconomic justice.
And why do you think we need an initiative such as Africa Reach?
An initiative such as Africa Reach is very important and timely for a continent such as Africa. First and foremost, half of the population is in its high reproductive stage, meaning that there is high potential among the young people to grow and reproduce and have their own families. And when we look at the continuum of care and what is required right from the pre-pregnancy stage to pregnancy and delivery, it is the responsibility of actors to be activated to make sure that all the stages in the continuum of reproductive, maternal, newborn, and child and adolescent care is actually sufficient and safely managed to prevent mother-to-child transmission.
How do you think we can include young people in the call to action in terms of advocacy for pediatric AIDS?
The first thing that we need to do is to mobilize and activate our young people. The issue of HIV has been living with us for very many years. I think it's already 40 years since we have been dealing with it within our communities. And I believe everyone and each one of us has either been infected or affected by HIV/AIDS. It is therefore going to be very necessary to mobilize the communities, and two, to ensure that our decision makers, especially political and policy decision makers, are sensitized to really take decisions that are useful, friendly, and responsive to the needs that are required by adolescents and youth. So we have the element of policy that opens the way for financing. And in this case, we require a lot of mobilization of resources, both human resource and budgets, to bring to the reality the kind of aspirations we have to combat HIV among the youth, and also to prevent the transmission to the next generation. This is how we can stop HIV.
And as a call to action, if you were to speak to African leaders and policymakers in different countries or in Africa as a whole, what would be your message in terms of accelerating HIV response?
My message would be very simple. Rise up, join us, let us fight this together, because we do have an opportunity to activate and bring HIV/AIDS issues back on the agenda and ensure that the gains that we have made in the last 25 years are not only secured, but also advanced into the future. I thank you.
Thank you so much, and thank you for your time. Thank you.